UnityPoint. Let's shift gears here and turn to something brand new here on The Current. 3 years ago, UnityPoint Health embarked on a trial run of sorts for a brand new virtual nursing course known as the Certified Acute Care Virtual Registered Nurses Program. A lot of words there, but fast forward to today, and of the 40 nurses across the country who helped develop this program's exam and were also the first to obtain certification, 7 are with UnityPoint. While most are in Des Moines, one nurse is based right here in the Quad Cities, and she joins us now right here on The Current. It's Emily Niebuhr. Thank you so much for being here.
Thank you, Shelby. Thank you for having me. I'm happy to be here.
Well, I'm excited you came in for lots of reasons, but for someone who works from home full time, I'm so grateful for your time today.
Sure, thanks for having me. I'm excited to be here to talk about our new program.
Why don't you break down the difference for us? What's the difference between a registered nurse you might see in a hospital and a certified nurse through this program?
Sure. So virtual nurses provide patient care virtually. We assist mainly with monitoring, documentation, and patient education. UnityPoint is proud to be one of the first healthcare organizations in the country to have certified acute care virtual registered nurses on staff. This is a new program that just started this year. UnityPoint does have 7. There's 7 amongst the first 40 in the country, so there's currently only 40 certified with this new certification. UnityPoint was also one of a handful of healthcare organizations that took part as subject matter experts in developing the exam and for establishing standards of practice for acute care virtual nursing.
So this has kind of been an interesting 3 years, I can imagine, as you all develop and learn throughout this program. But tell me how it works. When you go to work in the morning, what do you do?
So in the mornings, we have scheduled days we work. I work Monday through Thursday. I clock in at the same time every day. We listen to a meeting, and it's the group of department heads that talk about the possible discharges for the hospital today. That's the main driver for our job. We help with the nurses we help them with admissions in the discharge process. We also help them with documenting with care plans or assessments, many different things. We provide the educational materials to the patients and their families at discharge time. We give them to them virtually.
So what has the impact been to have a team of remote nurses with UnityPoint? How does that help out the staff that are, bedside?
Yeah, so virtual nursing is not meant to replace the bedside nurse at all. We work alongside the bedside nurse to assist with the admission and discharge process. We also give the patients the discharge education. This has led to a nearly 10% improvement in how patients are understanding their care at home, how to prevent readmissions to the hospital, and overall just a better care experience for the patients.
It's cool that, even so early on in the program, you already have these tangible results of saying this many % of patients have been impacted by this.
In just 3 years.
But I am interested, how did you become one of the first people in the country to do this?
Well, it was offered to UnityPoint and a handful of organizations to take part in this testing development and so forth. If you took the test and passed, you were able to become certified. And I'm sure this is something that's going to be offered again throughout for our system and other hospital systems. But yeah, I really love my job. I love what I do. I've been a bedside nurse for 20 years in the hospital. And this job kind of fell into my lap like a unicorn job, they say. I worked in-house doing sort of the same thing, and then they decided to transition to virtual, and that was a little over a year ago. And I love what I do because I get to help out the bedside nurses and the patients, of course, but just to help take out that extra load off of them, take a task or two away that might help their day go a little smoother, because, I know how it is.
Yeah.
It can be very busy and overwhelming.
Well, then my last question for you is this the future of nursing?
Well, I hope it is. We definitely have plans to expand. We want to get into more hospital systems. Currently, we are in 13 hospitals, 34 inpatient units, and cover over 1,000 beds system-wide. So we want to get into more hospitals in our system, more units, increase our tasks of what we can do for the nurses. So yeah, we're excited what the future holds.
Big things on the horizon.
Yes.
Emily, thank you so much for joining us today.
Thank you very much for having me.
For you guys at home, you want to share this story, we do have an online version up on our website, and you know where you can find it, under the As Seen on TV tab.